All right, guys, so welcome. It is 7 o'clock Eastern time here in Boston, so we're ready to get started for our class this morning. I'd like to introduce myself. My name is Allie. I am a doctor of physical therapy as well as a nationally certified Pilates instructor. I have been practicing here in Boston for the last 5 years, as well as recently opening my own practice and teaching with the Community Online Academy since its beginning in March. So the class we have today is a 30-minute program on managing back pain with a foam roller. So it's going to be entirely movement-based. We're going to go through some stretching, some strengthening, a lot of foam rolling. So if you guys have any questions throughout this program, we'll save a moment or two at the end to go over those questions. But on top of that, I always try and highlight that this especially this foam rolling class has a lot of options to modify and to make the program specific for you. So if something doesn't feel right or you want to spend a little bit more time on one area than the other, make this class custom for you. And that's how you're going to get the most out of this workout. Please don't be afraid to take a modification if you need it. You know your back better than I do. So with that being said, I want to get right into the movement part of our class. We're going to start taking our rollers back onto our mat and lie the mat perpendicular so that it goes right behind your knees. And then we're just going to lie down on our backs. I'm very excited to be teaching you guys this class as my first class today because it feels good. It's a really nice way to start your day. So what we're going to do is lift our hips up, roll the roller underneath our sacrum. Our sacrum is the bone that's between our tailbone and our lower back. It's that flat bone on your pelvis. When you place the roller there, it should feel fairly comfortable. If it doesn't, go ahead and adjust your roller until it feels more comfortable and just let your body relax. So we start our back pain classes this way, especially early on, because this is a nice decompression of our spine. So by just lifting our hips higher than our heart, we're allowing the space in between each one of our vertebrae to open up just slightly. So if you have any nerve sensitivity or nerve irritation, the nerves that exit our back are now given just a tiny bit more space. So we just lie here and we'll focus in on our breathing. I want you guys to try and expand your breath by expanding both your belly and the sides of your rib cage. Open out to the side, open up to the ceiling, and even open down into your back. And just allowing your breath to expand in that way, especially deeper into your abdominal cavity, helps to start to mobilize your diaphragm, which is that big breathing muscle deep into our abdomen. The diaphragm also plays a role in how the rest of our abdominal muscles fire. So it's important to us in managing back pain to help us support our core, support our spine with our core. So we'll take one more deep breath here. Excellent. And then from this position, we're going to bring our right knee in towards our chest. Hug that knee with both hands and stretch our left leg out straight. So keeping the left leg long, you want to reach it as far away as you can. You should start to feel an openness through the front of your left hip. That's your left hip flexor. And your left hip flexor muscle, it actually attaches to your low back. So it comes right through your stomach over the front of your hip and attaches to your lower back. So this is a nice place to start to create some mobility. We'll use the shape of the roller to open up the front of our hip. If you're not feeling this stretch or you want to deepen the stretch, bring your left leg to the midline of your body and draw your rib cage down as though you're pressing the back of your ribs into the floor. We'll take another deep breath here. And then we have an optional add-on to take the hands behind the right thigh instead of on top of the knee and stretch your right thigh up to the ceiling. Reach your heel up. You can point your toe. If you have any sciatica symptoms, I recommend keeping your toe pointed I think you'll find as you flex your foot that that puts more pressure on the sciatic nerve. So you can kind of test that just to see, but try with the pointed toe to bring that leg in towards your chest, reaching the heel long up to the ceiling. We'll take one more deep breath here. And then go ahead, bend your right knee, bend your left knee as well, bringing the left knee in towards your chest. Now hugging the left knee and straightening your right leg out long. And it's not uncommon to feel quite a difference from side to side. So just notice that here. It may actually be helpful in deciding how you want to stretch the rest of your body in our foam rolling set, whether one side is much tighter than the other, and maybe you want to spend a moment or two there. So see if you can draw your right leg to the midline of your body. See if you can press the right heel down into the floor, stretching it away from you. Pull that left knee in a little bit closer. I see a couple people are just getting logged in. So right now the roller is under our sacrum, not your lower back, just to be clear here. The sacrum is the bone between your tailbone and your low back. Good, we're gonna go into that optional add-on here by hugging behind your left thigh, reach your left heel up to the ceiling, and now you can feel a stretch through your hamstring on the back of your left leg. And this is really nice to do this kind of hamstring and hip flexor stretching when the spine is decompressed. Sometimes the method of more traditional stretching for a hamstring and hip flexor put our spine in a very compressed position. So it can almost irritate some more acute spine conditions to stretch in that way. We'll try one more deep breath here. And then go ahead and bend both knees in towards your chest. Very gently rock your legs from side to side. You can massage out some of those muscles right at the base of your pelvis. And then place both feet down onto the floor. You're gonna lift your hips up, take that roller out from underneath your sacrum, let your hips just rest down onto the mat comfortably, let your spine get settled for a moment. And then we're gonna place the roller underneath the arches of our feet. And you want the roller to be fairly close to your bottom. So you wanna almost be able to tap your heels with your fingertips. Before we move at all here, think of pushing down into the arches of your feet. So I want you to imagine the roller is super slippery. It's trying to roll away from you. See if you can pin it down with your feet. We're gonna go into a bridging exercise, which is for our glute or hip muscles here. So right away, go ahead and lift your hips on up to the ceiling. See if you can keep the roller still as you then lower your hips back down. Lift your hips on up and lower the hips back down. Now, if you're having trouble keeping the roller still, it's because your quad muscles, the ones on the front of your thighs, are doing too much of the work here. The work should be in your butt and in your hamstrings. Now, if you feel like you're getting a cramp here in your hamstrings, imagine something between your knees that you are hugging in on, like a ball or a pillow, and try and keep pressure on that imaginary ball or pillow, especially as you lower back down. You can also double check to make sure you actually feel your butt muscles working. This is very much a hamstring exercise, which is on the back of your thighs, but you should also feel your glutes. So sometimes our hamstrings will cramp when they are being overworked because they are not getting support from the glutes. We'll try two more here. Awesome, guys, that's it. One more time, keep that roller super, super still, lifting up, and then drop right back down. You can take a rest, keep your feet up on the roller, and just gently rock your legs from side to side. So the reason we focus in on our glutes for our back is because our glute muscles provide a big support for our back when we're bending and squatting. Good. Okay, so from here, you can push the roller away, roll yourself on up to a seated position. We're gonna get into our upper back a little bit. So let's go ahead and take the roller once again perpendicular to your mat. This time the roller is gonna come down between your shoulder blades. So I like to just hold the roller. I get a lot of questions. How come the roller is slipping out from underneath me? Hold it with your elbows, bend your knees, think of pushing your ribs into the roller, and then hold your head with your hands. And that way you're really pinning the roller down with your own back. So once you're in this position, we're gonna lift the hips up and start to roll to the very base of your neck and down to the middle of your rib cage. If you're relatively new to this foam rolling technique for your upper back, you can make the range of motion where you roll small. But if you're someone who's taken my class before, you've done this with me, I want to challenge you to really get right up to the base of your neck and then down just below your shoulder blades. So in this type of rolling, we actually do not roll into the lower back, and we'll go over why. But right now we're focusing in on the upper part of our back. And I really want you to try and get that upper part of your back right at the base of your neck. That's actually the spot where we see some of the most stiff segments in most people. And that's often related to sitting, using a computer, typing, all of that fun stuff that we're probably spending too much time doing right now. So as you roll back and forth, we're just helping to release the muscles around the spine, also around the shoulder blades, but we're also very gently starting to mobilize the joints in our back. And we have joints that are along our spine. We also have joints where our rib cage meets our spine. If you find one of those tight spots, you can go ahead and place your hips down and very gently let your spine drape over the shape of the foam roller. Now, when you drape your spine over, it's not letting your head hang back. It's actually dropping your sternum or your chest back. And at the same time, pulling your front rib cage down. So your core is actually active here, and that's to help protect your lower back in this position. So as I mentioned, one of the benefits here to mobilizing those joints where your ribs meet your thoracic spine or your upper back is that you get better rib mobility. And better rib mobility means better breathing. And we already talked about how breathing using our diaphragm helps us use our core better. So in a very roundabout way, as we move our spine here, we're actually helping to allow our core to strengthen. Good. Now we're going to go back into that rolling. You can try a different spot, place your bottom down, dropping your spine over the roller, or you can just continue rolling front to back. But we'll add in a couple dimensions to get a little deeper into those rib cage joints. And so I'll show you in sitting. You guys keep rolling here. We're going to add in a side bend and a rotation. Side bending is dipping your elbow towards your hip. Rotation is turning one elbow up to the ceiling and the other one down to the floor. So let's walk through that together. So as you're rolling back and forth, try tipping your right elbow towards your right hip. That's going to open up the joints of your rib cage on the left side of your body. So notice, see if that feels tighter, looser, maybe you feel better on this side. You can do the same thing now and tip your elbow on the left towards your left hip to open up the right side. And I know for me, this one feels a little bit tighter this morning, so I'm going to spend an extra moment or two here. You guys can make this class your own. Spend time where you feel tightness, which might be different than me, different than your friends, different than your neighbors. Good. All the while, make sure that you are still breathing. So you don't want to hold your breath here. Allow your breath to be comfortable and natural. Good. Now we can add in that element of rotation as well. So if we come back through the center, tip one elbow up to the ceiling, one elbow down towards the floor. This is going to help you to get into the lat muscle, which is along the sides of our rib cage from our shoulder all the way down to our lower back. So that is also a sneaky source of tightness for many people through the low back and through the rib cage. And this one can be sensitive, so you don't have to put a ton of pressure in. Just go slow, be gentle, feel the length of your the bottom of your ribs all the way up to your shoulder joint. You can even pause and place your bottom down, try some of those stretches backwards, or just continue rolling front to back through those zones. Good, keeping your eyes on your knees here, nice and gentle back and forth. And the reason here we're not rolling into our low back is that the pressure of the roller would actually be a little bit too much in the low back for most people. It feels okay here in the rib cage because we have our ribs there. So it's like a double protection to get mobility through the joints. Our low back actually already tends to be quite flexible in some ways, and tightness you may feel may be more muscular tightness than anything. So we'll do one more moment here, and then sit our hips down and come all the way on up to a seated position. All right, so nice job. So we talked about breathing. Now that we just did all of that work, sit on up nice and tall, take a deep breath in, and hopefully you feel like you can expand your breath a little bit bigger than when we started class. So I was just mentioning muscular tightness. We're gonna try now to address some of that muscular tension surrounding our low back, and we'll start in our hamstrings today. So we're gonna take that roller back in front of us, placing our hamstring muscles, which is the meaty muscle on the back of your thigh, down onto the roller. And we'll start with both legs down. This exercise does require you to put some weight through your wrist. If you're very, very sensitive in your wrist, try coming down onto your forearms. So either is an option. I will demonstrate first here on the wrist. So you're gonna open up your collarbones, give yourself good shoulder posture, lift your hips off the mat, and when you roll, you wanna roll just above your knee and then all the way up to your glutes, your butt muscle. So the hamstring actually inserts on our pelvis all the way up by our glutes. So to really get the full length of your hamstring, you have to come up fairly high. Now, when we're foam rolling, and this is just a general principle, you want to be sensitive to rolling over bone. Bone on its own, so if we were to go right over into the knee joint, it can be quite sensitive, and you don't really get the benefit of mobilizing the soft tissue because there's not a lot of soft tissue there. Just going over bone, if anything, really leaves more like a bruise. So nice and easy, back and forth. Now, as you're finding tight spots, you can spend an extra moment or two there. If you want to put more pressure on one side, cross one leg on top of the other and do the same rolling technique. Now, our hamstring is actually made up of 3 muscles, and they lie one next to the other. So in order to really feel the difference between those, you can very slightly roll your legs in or roll your legs out to feel the difference between that outside, middle, and inside part of your hamstring. And different people are going to be tight in different zones. This is another chance for you guys to customize this class towards you. Wherever you feel that tightness, spend a little bit of extra time there. And if you want to keep both legs down throughout this whole set, that is fine. One other little caveat I have here is that you can straighten your legs here, but if you have a history of any nerve issues or sciatica, keep your knees a little bit bent in this position. Now, if you're down on your forearms, you're doing the same exact thing. It's just a little bit more work for your shoulders and for your core. So same setup, you're just trying to keep your neck long. Be cautious and notice if your shoulders are hiking by your ears. We are working on our lower body, but we want to protect our upper body at the same time. So I would recommend spending about a minute or two on the hamstrings. And if you're doing one side at a time, maybe a minute and a half on each side. So we'll spend just a moment longer here. And then we're going to make a nice easy transition. We'll take our hands off, shake out our wrists for a moment because we're going to stay up on our hands to go into our calves. So we're just going to push the roller past our knee joint. Like I said, we're not going to roll right over our knees, and put the roller right underneath our calf muscles. same setup. Now we just have a little bit more lifting to do from our arms to get our butt off the mat. So we're gonna roll from the very base of our ankles right up to the back of our knee. And again, you're gonna find different spots are tight in different people, and maybe even from side to side. I always love to focus on the calves. I know it feels far away from our back, but when you think about walking or running or going up and down stairs, the first thing in our body that gets to do shock absorption is our calf muscle. And so if our calf muscle is firing really well, it can take a big part of the shock of landing on the ground before it goes into our back. And so that's really, really important if your back is sensitive to compression. Now, just like in the hamstrings, you can rotate your legs in or out by just rolling your body side to side and notice the differences. So we have small muscles on the inside and outside of our calves. We have the posterior tibialis, we have the anterior tibialis, we even have the peroneals, which are on the outside of our calf muscles. They all provide little bits of support for our ankles. If your wrists are getting tired here, you can always come down to your forearms. You get the added benefit of a lot of shoulder work, a lot of core work here. So take breaks if you need to. If it's starting to get stressful for your neck, put your bottom down. You can even do some light rolling with your bottom down by just bending and straightening your knees. It's not a lot of pressure, but that is a good interim option if you're getting tired here. Good. So we'll try 2 more just like this, nice easy rolls. And 1 more time. Good. Okay. Now, to give our arms a little break, we are going to do 1 more foam rolling for the front of our legs, but we're going to go into a little challenge of some strength work. So we talked about walking and the impact that we go through with walking. One of the other factors of what impacts, especially side to side walking, is how stable your pelvis is. So ideally, when we walk, our pelvis stays pretty level. And that means, I'll stand for just a second so you guys can see, that when I'm walking, I'm not getting a big side to side movement. That's a lot of shearing at our low back. So one of the ways we can test to see how stable you are through your pelvis when you walk is by lying on our foam rollers. And that actually comes from core strength. And it's different core strength than you might think of from a sit-up or a crunch. This is really core stability, some of those deeper core muscles that hug around our spine, keeping our spine still. So what we're going to do is take our roller lengthwise, and this is where if you have a shorter roller, you're going to need to modify a little bit. So we're going to lie with our head here and our bottom here, so our spine is along the length of the roller. So you're going to take your bottom down. I like to just walk my hands back so I make sure that my head and my bottom are on the roller. If you have a shorter roller, make sure at least your head and your upper back are on the roller. You can then try and put pillows under your hips or even just use your legs to lift into a small bridge, holding your hips up. So once you're here, just take a moment to feel centered. Sometimes, even right away, you can feel that your body is tipped more to one side than the other. Try and center yourself on the roller. Be honest with your feet. Try and walk your feet into a true hip distance apart. And then reach your arms up to the ceiling. Just get your balance here. Notice if your body really wants to spend more time in one side than the other. See if you can push down equally into both feet. Think of using your shoulder blades to hug the back of the roller. And so that's how our upper back can actually contribute to stability for our spine. So once you're here, once you feel fairly stable, you can bring just the tips of your fingers on the floor. And all you're going to do is try marching your feet off the ground. You can actually really just lift your foot an inch or 2 off the ground. It does not need to be a big lift. If you want, you can make it a little bit bigger, but go slow here and see if you feel really wobbly lifting one side compared to the other. Now, if you feel pretty good here, try lifting one of your hands and doing the same thing. Think about pushing the back of your rib cage down as though you're kind of activating your core like a plank, and try the opposite hand, same thing. Maybe if you've been taking my class and you want to try lifting both hands, this is the most honest look at how stable your spine is with something like walking. And of course, the roller makes those little deviations way more obvious, but give that a try. And this is something I had to practice for months to get good at. When I first started doing this exercise, I was terrible at it and would fall frequently. But finding that deep pressure of the back of your rib cage onto the roller, as well as that nice symmetry of pressing into the opposite heel, can help you to get a little bit more stable here. Good. We're gonna try 2 more just like this. And 1 more time. Good. And then just rest your feet down. We'll give ourselves a little chest stretch while we're here. So open up your arms wide out to the side. You can walk them up high or down low, and just let your arms sort of drape over the shape of the roller. This is a really nice chest opener if you tend to be tight through the neck and shoulders as well. And I encourage you guys to take what you learned from being on the roller here today just as data. I think probably you know which side is a little bit trickier for you, and maybe it's worth spending an extra moment or 2 working on exercises addressing that side, both hip and core. So we'll take 1 more deep breath here, and then we're gonna roll off to the side. Good. And focus in on our last muscle here, which is the quad muscle. So right in the front of our thighs. So our quads are important for tons of things. We tend to, if anything, overuse our quad muscles when we do squatting or stair climbing type exercises. So it is nice to give those muscles a release. We're gonna turn our roller back to that perpendicular direction, this time putting the meaty part of our thigh right on top of the roller. And then you can stay on your hands. I find this one much more comfortable down on the forearms. So you're just gonna put the weight of your thighs on the roller. You can keep your toes down on the mat. You can also lift your feet, whatever is comfortable. One thing to note is that normally you would feel comfortable letting your spine sag. I want you to actively lift your ribs away from the floor as though you are in a plank position. And then you're gonna army crawl, walk your elbows forward and walk your elbows backward. Once again, rolling just like your hamstring, right up to the length to the top of your pelvis, and then right down to the bottom of the thigh, right above your knee. So the quad and the hamstring are antagonist muscles, meaning they work in opposition to one another. So they also run along the same length of the thigh. The quad, unlike the hamstring, is made up of 4 small muscles. And so just like we did on the back of your leg, you can roll your thigh in and out and notice the difference between the inside of your leg and the outside. And that may be different from side to side as well. Be careful here to not go all the way onto the knee joint, but just spending a little bit of time on the thigh itself. You can also pause if there's one particular spot of a lot of pressure, put your toes down, just hold it there. Maybe you do little smaller rolls back and forth. Maybe you feel better with a big range of motion, pushing all the way forward, all the way backwards. Just try and keep your head lifted, your shoulders down away from your ears. Awesome. And we'll try 1 more here. Good. And then very gently press yourself up and back, and we'll take a gentle shoulder roll coming out of that position. So I want to show you guys, this exercise really only works with a longer foam roller. So I apologize to those of you who have a shorter one, but I want to show you this because it's a nice little trick. If you only had a minute to do a standing exercise, you're going to stand up, take your roller. Let me adjust my camera. Remember that sacrum that we started class with. You're gonna put your roller on your sacrum again and turn your palms to face forward, holding the sides of the roller. So your arms are opened up wide out to the side with the roller right at your sacrum. The reason this doesn't work for a shorter roller is that your hands have to be quite narrow. So once you're in this position, you're gonna ground your feet down into the floor, push the roller into your sacrum. So like you're pushing it into your back and very gently leaning backwards and then coming up tall. So this is an extension stretch of your low back. We spend a lot of time bent forward in the sitting position in flexion. So this is a nice opposition to all of the flexing that we do throughout our day with sitting. And you can just hold for a moment or two, stand up tall, keep the pressure into your hands. Try just 2 more like that, pressing hips forward, standing up tall. And one more time here, pressing the hips forward, hands into the roller, come all the way on up. You can place that roller down, and you guys are all set with the movement part of our class. So we have just a minute here. If you have any questions, I would love to take them. You are welcome to unmute yourself if you would like to ask a question that way, or write them to me in the chat. And I do ask that if you have a moment to stick around and leave feedback for this program, I will put the QR code up in just a moment so that you can leave feedback directly for this class. So any questions? Okay. So good question here, how to keep the roller from sliding away from you. I'm guessing you're talking about the one at the upper back or with the legs. I'll talk a little bit about the upper back. So let me show you quickly with that one. With the upper back, I think it's easy. Let me tip this down a little bit so you guys can see here. If the roller is rolling away from you, chances are it's because you're not pushing your rib cage into the roller enough. So if I roll really far down and I'm not pushing my spine into it, it may slip away from me. The other thing though that I've seen from time to time is that if you're on a really slippery surface, like a hardwood floor, or if your mat tends to be a little bit slipperier, you may want to put something that's a little bit more grippy underneath your roller. So another question here, how often can this routine be repeated? I think that this routine, the upper back exercise we did and the core strengthening exercise we did, feasibly you could do that every day. I think it's most important to do on the days when you are sitting for a long period of time. So if you're up and moving, you probably don't need to do that on that day. When it comes to the rolling for your muscles, your quads, your calves, your hamstring muscles, that I would recommend doing 2 to 3 days a week. So rolling actually creates micro damage to the tissue. It's a good kind of damage in that that is how we get healing enzymes to our muscles and we actually remodel the tissue. But that being said, you need recovery time for the tissue to actually remodel. So what I would recommend is 2 to 3 days a week with the rolling on the muscles. You could though, theoretically, if you rolled your calves one day, your quads on another day, your hamstrings on another day, you could roll every day if that was something you wanted to do.